Hello and welcome to Boosting You, our ultimate wellness platform. I'm Dr. Sue Peacock.
And I'm Shirley McLean. And today we're going to focus on anxiety. Is that right, Sue?
That is, yep, that's what I thought. What we could do today was focus on those sort of evidence-based cognitive and behavioural approaches to anxiety, which form foundations of sort of most conventional psychological treatments.
Yeah, and I'm looking forward to this. Even though my practice incorporates alternative modalities, I always emphasize to clients that these should, complement rather than replace evidence-based treatments. The cognitive piece is so crucial.
Yeah, I appreciate that perspective, absolutely. So if we start with, say, cognitive approaches, at their core, these are based on our premise that our thoughts significantly influence our emotions and our behaviors.
Mm.
If we're dealing with anxiety, we're often thinking, we're often having those thought patterns that overestimate the threat and underestimate our coping ability.
Right. So, like catastrophizing or fortune telling, assuming the worst, the what ifs, the worst possible outcomes that will happen. A lot of people that I see do a lot of what ifing that people do.
Absolutely. So in cognitive behavior therapy, we teach clients to identify these what we call cognitive distortions. I tend to call them unhelpful thinking patterns because that
Mm.
sounds better. So common ones for people with anxiety, as you said, are catastrophizing that, such as, if I make a mistake in this presentation, then my whole career is over. Or there's that sort of all or nothing thinking, if I'm not perfectly calm, I'm going to fall apart completely. Other things would be overgeneralizing. So, I felt anxious at the last party, so I'm going to feel anxious at every single social event I go to from now onwards, kind of thing. Or there's one that I can sometimes joke with my clients about, that mind reading. Everyone can tell I'm anxious and thinks I'm really incompetent, kind of thing.
And I found that, many clients don't realize how automatic these thoughts have become. They experience them as reality rather than interpretations that can be questioned.
Yeah, absolutely. And that's where that sort of cognitive restructuring comes in, helping people evaluate the evidence for and against these thoughts and perhaps considering alternative interpretations and developing more balanced perspectives. It's not about, positive thinking, putting on your rosy colored glasses, pretending everything's okay. It's about more balanced, accurate thinking.
Yeah, and when I'm working with hypnotherapy or NLP, I often frame this as updating or reprogramming the subconscious programming. So we're essentially doing the same work but approaching it through different doors. The conscious, the analytical mind versus the subconscious pattern recognition mind.
Yeah, absolutely, because that's a really interesting parallel, isn't it? Because on the behavioral side of cognitive therapy, exposure therapy can be one of the most powerful tools, especially for specific phobias or social anxiety, for example. And one of the principles is relatively straightforward, but quite challenging to implement, that gradual repeated exposure to feared situations without engaging in avoidance behaviors.
Yeah, I've seen how difficult this can be for clients. So could you walk us through how you might structure an exposed hierarchy? Hierarchy?
Yeah. So obviously we teach coping strategies before we kind of went into this. So if we think of, say, social anxiety as an example, we'd almost create a ladder of situations from the least provoking anxiety to the most provoking anxiety. And it may look like um, making eye contact with the cashier in your local supermarket. So, rate that out of 100.
Mm.
Not being, really, 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 really bad. They're really, really good, sorry. And 100 being really, really bad. So they might aim that as, say, 30 out of 100. So
Yeah.
that's okay. And they think, okay, yeah, we can do that. And then once they've done that, then it's perhaps asking a stranger for directions that they perhaps might rate 40 out of 100, or making small talk with a colleague could be, say, 50. Um, and then it kind of ramps up a little bit, doesn't it? Sharing an opinion or a thought in a small meeting could be perhaps 65, or
Mm.
Asking a question in a large meeting could, that could be rated, say, 75.
Mm.
Giving a short presentation to, say, a friendly audience could ramp it up even more to, say, 80, 85. And then, they're probably, it may be, that giving a presentation to like senior management could ramp it way up to sort of 95 out of 100. So what we get them to do is each person practices each step using relaxation techniques or different other techniques that we teach them to manage that anxiety until that step no longer produces significant distress, and then they move kind of to the next level.
Right. And in my practice, I might support this process by using hypnotherapy to help clients mentally rehearse those scenarios in a deeply relaxed state first. And that can sometimes create that bridge between knowing intellectually that they'll survive the situation and feeling emotionally prepared. So I give them thought stopping techniques as well.
Absolutely, that's really really valuable. Absolutely. And another sort of key behavioural component, I guess, is sort of teaching relaxation stress, relaxation techniques, or self-hypnosis, to address those physiological aspects of anxiety, such as diaphragmatic breathing, progressive muscular relaxation, and various different forms of relaxation or mindfulness.
Yeah, those are foundational in my practice as well. So we both use those together. And I find that, the diaphragm breathing, particularly, it's powerful because it directly counters that shallow chest breathing pattern of anxiety and activates that parasympathetic nervous system.
Yeah, absolutely. So let's have a little bit of a chat then about how we can implement these techniques with the people that we see. So typically I sort of start with sort of psychoeducation, kind of
Mm.
helping our clients understand, cognitive behavior models, how thoughts, feelings, physical sensations and behaviors and emotions all kind of influence each other.
Yeah, and that awareness alone can be transformative. I often use the metaphor of anxiety as an overprotective guard dog, which I've got a German Shepherd. It's trying to keep you safe, but it's been trained to bark at everything. Even the mail, the postman when who comes every day.
Yeah, but that's a really helpful way to frame it, isn't it? So I think the use of metaphor is perfect, absolutely. So kind of once we've established their understanding of anxiety, I sometimes introduce things like thought records, the structured worksheets to help people document those triggering situations, starting to recognize those automatic thoughts, those emotional responses. And then we can start to look at them and challenge those thoughts perhaps with evidence-based and perhaps alternative perspectives.
Yeah. How do you help clients who struggle with identifying the thoughts? I find some are so overwhelmed by the physical sensation of the anxiety that at times they struggle to really access the cognitive component.
Yeah, that's a really common challenge, isn't it? Because we don't automatically, you know, think that way, do we? It's almost about working backwards. So we need to start with those physical and emotional components and work backwards from that. So things like, so when you feel that tightness in your chest, what's going through your mind? Or sometimes we can look at the behavioural aspects and responses first. You say, for example, you mentioned that you avoid team lunches. What are you afraid might happen if you did actually attend?
I use a similar approach, though sometimes with hypnotherapy, we can access those thoughts through guided imagery or regression techniques when the conscious mind is drawing a blank.
Yeah, I think that's a really good thing to do. Yeah, and it's so great, isn't it? How hypnotherapy, you can almost practice these situations in hypnotherapy, isn't it? Another technique that, excuse me, I quite often find effective for managing anxiety is sort of scheduling worry time. So, sort of setting aside 15, 20 minutes daily specifically for worrying. Because there's no point saying to people, don't worry, because that just makes them worry even more, doesn't it? So, if we've got a worry time almost. So, when anxious thoughts are arising outside that time, we get people to write them down for the worry time and just refocus on the present moment and then
Yeah.
reflect back at their chosen worry time.
Yeah, and that's fascinating. I use a worry window. I think you sometimes do call it a worry window, don't you? A time that they choose. And it's interesting because it's giving the anxious part of the mind a voice rather than trying to suppress it, which often does backfire. So it's similar to a technique that I use as well. You probably do use this with your hypnotherapy parts work where we dialogue with the anxious part rather than fighting against it. So we've got this part of us wants to be anxious, part of us wants to be relaxed and get on and do all of these things that we've got to do. So rather than fighting against it.
Absolutely. And that suppression, doesn't it? It tends to increase the power of our thoughts.
Mm.
So I thought today, before we kind of wrap up today's discussion, I wanted to sort of talk about the importance of lifestyle factors in managing anxiety. There's lots of evidence out there, isn't there, for regular exercise, adequate sleep, limiting our caffeine and alcohol intake, but also, positive social connection all have, really good, significant positive impacts on anxiety levels.
Yeah, those foundations are so important. I often tell clients that all the little techniques that we're discussing will be so much more effective when they build on the foundations of good physical self-care and give them some guidelines to follow as well.
Yeah, absolutely, absolutely. So I think next time we meet, then I think it'd be really valuable to dive into your approaches, perhaps hypnotherapy and NLP for anxiety, because I'm, as you know, I'm really interested in how these components complement cognitive behavior strategies that we've talked about today.
Yeah, and I'm looking forward to sharing those perspectives. The integration of these approaches can be really powerful for clients.
Absolutely. So until next time, then, it's bye from me.
And it's bye from me.